on Ayurveda for the health of Indriyas. Madam invited as a guest speaker in Shalakya Sandipini International Conference held at Colombo on 15th and 16th September 2017 and delivered a lecture on practical utility and scope of Dhumapana in nasal disorders. Madam received many awards like a Mahatma Gandhi Shanti Award in 2014, Dr. APJ Abdul Kalam Azad Award and Academic Excellence Award in 2015, Excellence Award in Ayurveda in February 2020. Madam is a author of the book of Concept of Glaucoma in Ayurveda and Modern Science, published by Chaukamba Orientalia Varanasi. And Madam presented 2 radio talks for Radio Sanjeevani at Hassan and 7 TV talks for Rajasthana Patrika, Jaipur. I heartily welcome you, Madam. Over to you, Madam.
Thank you, Doctor. I'm very pleased to be a speaker for this webinar series. So today's topic is also very interesting. So I think it will benefit all the UG students as well as the. Without wasting much time, I would like to start my topic. That is on the first we will start with the examination of the nose, and then later on we will go to the Chikitsa Sutra of Pratishyaya disease. So we'll let us just I will connect my PPT so that it is visible to all of you. PPT connect करो पहले. One minute, there's some problem in uploading my PPT. Just a second.
Okay, Madam.
is my this thing visible? PPT? Hello? Is my PPT
Ma'am,
visible?
visible, ma'am. Visible.
Okay. So sorry for the delay. So without wasting much time, let us start with the presentation. So let's begin with the examination of the nose. This is a very important uh, examination because whenever we examine the sense organs, nose is the prominent part and it is easily approachable. And most of the diseases, 90% of the diseases of ENT are related to the nose. So that is why we should never miss the examination of the nose. So that is why before proceeding with the examination, we have to also follow some protocol, that is taking the history. So history taking is very important, and because many times we can diagnose the disease only with the proper history. So that is why some diseases are diagnosed only with proper history. And so we have to know what are the important symptoms which are occurring in the nasal cavity. Like in allergic rhinitis, we have the sneezing, nasal discharge, nasal blockage, etc. So that's why we need to differentiate whether the disease is related properly to those or it is because of some disturbance in the areas like concomitant nasal allergy. So if there is a concomitant allergy, then we have to examine the other structures like the eyes, then the throat, etc. So that is why we have to take a proper history so that we come to know at the primary disease. So identifying the primary disease is very important for treatment. So once you give treatment to the primary disease, then automatically the other symptoms also subside. So that's why hello, is it? I'm audible? Hello, am I audible?
Audible, madam. Nothing to worry. It's okay.
Okay. So starting with the, so in Ayurveda we have Darshana, Sparshana and Prashnai. So let us begin the examination with Prashna Pariksha, and later on let us move on to the other examinations, because this is very important aspect which is usually missed out by most of the students. So that's why we have to identify what are the chief complaints which usually patients come to us and give in the form of history. So main important symptom which a patient present to us is nasal obstruction. So nasal obstruction, as you the patient tells the problem, then you can come across so many related issues, like it may be because of DNS. So all these points should come into your mind. So what are the questions you're going to ask? So those should be prepared in your mind, and you should ask those questions so that you can identify the primary disease. So if there is nasal obstruction, so you have to think of any primary obstruction in the form of this deviated nasal septum, or it may be turbinate hypertrophy, or it may be because of this polyps or any growth. So all these things you will identify once you go for examination. So nasal obstruction, you should ask whether it is temporary or transient, or it is there is complete blockage, whether it is unilateral or bilateral. So that you can, when you are examining, then you can not miss even simple diagnosis like. So all this is very important. Then next important symptom is nasal discharge. So usually patient complain with this nasal discharge. So this nasal discharge may be either in the form of anterior discharge, or it may be postnasal drip. Most of the patients, they have postnasal drip, but usually they will feel that this discharge is coming from the lungs. So some in the cases you have to ask some more questions, so the patient gives proper history whether discharge coming from and getting accumulated in the throat, and then it goes downwards, and the patient may complain of cough, etc. So most of the problems will be related to the postnasal drip. And also looking at the nasal discharge, you should ask whether the discharge is watery, or it is yellowish, or it is mucopurulent, so that you can diagnose the different diseases. So if it is watery discharge, then you have to think about diseases like acute rhinitis. It may be acute rhinitis. So acute rhinitis will be ruled out if you ask the chronicity of the problem, whether it is in a 1 week or 2 weeks, or it is persistent since many weeks. So then you can come to know that whether it is due to allergic rhinitis, or it may be because of vasomotor rhinitis. And also you have to ask whether the discharge is yellowish. So it may indicate that the discharge may be, so if it is mucoid, it may be in the form of acute rhinitis or acute sinusitis. But if it is long-standing discharge, so usually there will be chances of rhinosinusitis, and the discharge, when it is infected with secondary bacterial invasion, then it becomes yellowish in color, and it will be associated with other symptoms like fever, etc. So you have to ask all those questions so that you can also come to know whether you need to also clear that infection which is persisting in the nose because of the unhealthy atmosphere and persistent discharge which is invaded by secondary bacterial invasion. Then the other most important symptom is sneezing. So sneezing, it may not be a primary symptom, but it may be associated to some primary disease like allergic rhinitis or vasomotor rhinitis. So again, you have to ask many questions in order to rule out what is the cause for sneezing. Sometimes sneezing may be because of some entry of insect, or maybe because this any allergen entering the nose. Then it may itching also is important symptom. Itching is not only present in the nose, but it may also be associated in the eye in the form of allergic conjunctivitis, or it may also be present throat in the form of allergic this allergic pharyngitis or laryngitis, etc. So you have to ask about this, because itching is also a very important symptom, but it is not a primary symptom. It is signifying a primary disease. Then next important symptom is bleeding per nose. So this is, as we call it, taxis. So whether it is tinged nasal discharge, bleed associated nasal discharge, the disease will be Pratishyaya. If it is pure bleeding, then it comes under Nasagat Rakta Pitta. So you have to identify all that, and you have to ask whether it is anterior type of bleeding or posterior bleeding. So 90% of the bleeding in children is from the little's area. So, and also sometimes children have the habit of scratching the nose, etc. So especially when there is itching. So and also when there is dryness of the nasal cavity, there will be crust formation. So children try to remove this crust and they will be bleeding. So you have to identify, see the little's area when you are examining, so that whether the bleeding is anteriorly or it is coming from deep inside the nose in the form of posterior bleeding. So it may be some bleeding vessel, or because of hypertensive patients. So if it bleeding in an elderly, usually we have to ask whether there is history of any hypertension. And also sometimes there may be bleeding from the woodruff's area, that also has to be inquired. Then nasal crusting is also very important symptom, especially in case of atrophic rhinitis. Because of the atrophy and because of the dryness in the nasal cavity, the secretions become dried up and they get stagnated. Along with the crusting, sometimes there may be foul discharge, smell, etc. And this usually with the crust, there will be some yellowish discharge, and associated sometimes because of that there will be ulceration and bleeding. So that you have to inquire whether it is primary atrophic rhinitis or it is secondary atrophic rhinitis, and since whether it is related to the anterior part of the nasal cavity or it is related present throughout the nasal cavity and also involving the pharynx, as it is seen in case of atrophic rhinitis. So anterior part of the this thing, crusting and dryness, it comes under the condition called as rhinitis sicca. Then next important symptom is disturbance of smell. So usually smell is the important identity by which the nose is recognized, and this olfactory area is especially important for the identifying the different types of smell. So because of some growth or obstruction, or because of chronic rhinitis, so then this there will be disturbance in the sense of smell. And so you have to ask since how long, whether it is transient or temporary. And sometimes the patient will get the sense of smell of some objects, and sometimes he will not get. So that also have to inquire. Because of the mucosal edema, whenever there is edema, there will be disturbed sense of smell. When edema gets reduced, patient will be able to hear the smell properly. So that also should be inquired. And also we should also go look for edema or swelling So that also you should ask whether there is swelling in the nose or PNS. You can inquire that there is edema from time to time. And hello. And also there is any history of foreign body entering into the nose, that also has to be inquired, or any recent injury which the patient has undergone in the past, that also should be inquired. And most of the time the associated symptoms will be like headache, or facial pain, or sometimes vomiting, or fever, snoring, epiphora, etc. So that also, or sometimes hoarseness of voice. So these all the associated symptoms. So we have to give importance to the primary symptom, because that is the chief complaint. A disease will be diagnosed based on the main complaint to which the patient comes. Like there is nasal obstruction, then you may have to diagnose disease as nasal, or if it is nasal discharge, then you may have to diagnose the disease as this Pratishyaya. So because Pratikshanam Shayate Pratishyaya, they will be discharged. And if it is allergic, if there is allergic rhinitis, other symptoms like itching, sneezing, etc. will be there. So in that way you have to identify. So that is why you have to also know whether it's concomitant allergy, which is because the wherein the other structures are also involved, like the throat or the eyes, in case of allergic conjunctivitis, or there is any form of allergy in the skin like urticarias, etc., or there is any sinusitis, associated sinusitis, which is giving rise to neck pain, headache, etc., or there may be symptoms in the form of bronchitis, etc. That also has to be properly identified. Then next, coming to Sparshana Pariksha, you can make a few diseases you can directly diagnose based on Sparshana Pariksha, looking at the temperature, whether there is any, if there is any infection, like in case of Dipta, there will be redness, and the temperature also rises. And also in case of sinusitis, tenderness test is very important. And if you are able to feel the tenderness in the canine fossa, then it indicates that it is maxillary sinusitis. And if there is tenderness in the frontal region, that is at the floor of the frontal sinus, then it indicates frontal sinusitis. And tenderness in the middle meatus, that signifies ethmoidal sinusitis. And usually there will be, in case of sphenoidal sinusitis, the patient will complain of pain in the vertex region. And along with tenderness, the skin also may be reddish, and they may be like in case of vestibulitis, there will be reddish skin on the nasal area, as well as sometimes the cheek may also be involved, and there may be the temperature also will rises. And also you can see if the skin of the nose, it is fixed, because of that also fixity of the skin can also be identified, and it can be pressed and you can see it. And also thickening of the soft tissues, or in case of fractures, you may have to ask for crepitation, or you can also palpate it. So with the history of fracture, then you have, or then what you have to do is you have to palpate for any sounds or crepitations, especially of the fracture of the nasal bones. And also in case of rhinoscleroma, there will be woody feeling, which you can see, and which you can feel it. And also sometimes enlargement of the bony skeleton as Fagot's disease, etc. So in that way, if there is cartilaginous enlargement also, you can also identify whether it is chondroma or chondrosarcoma, that you have to identify with palpitation. Then you're coming to the most important examination, that is Darshana Pariksha. So here you have to, before introducing any instrument, you have to go for just looking at the vestibular area, which will be missed out when you introduce the nasal speculum. So you can sometimes without using instrument also, you can elevate the tip of the nose and you can see the surrounding area, the vestibular area, whether there is any furunculosis, etc., because such points will not be diagnosed once you introduce the instrument. So here we can go for anterior rhinoscopy, posterior rhinoscopy, and also endoscopy can be done. So in case of external nose, you can see any furunculus, especially the vestibular area, furunculosis, because it is a painful condition, and sometimes this condition cannot be neglected also, because it falls in the dangerous area of the face, because this vestibular and the upper lip is falls in the dangerous area of the face, and in infection in this area particularly will give rise to cavernous sinus thrombosis. Then we have, if there is any septal abscess, then that also can be identified, especially in the septum, or if there is any sebaceous cyst or dermoid, glioma, etc., can also be easily examined in the external nose. And also you can see whether there are any post-operative scars, or there is any formation of congenital dermide or ulceration. Especially you can go for, you can see the rhinophyma or the cancerous cell carcinoma, etc. And you can see whether the nose is crooked. Sometimes just looking at the nose, you can come to know that there is some deviation, especially in caudal dislocation of the septum.
Okay.
The nose will be deformed, and just looking at the nose, you can come to know that there will be some this deviated septum present in the nose. So that also can be identified. And also in case of fractures, there will be deformity or twisted or any hump, etc. So that also can be further palpated also and can be seen. And in case of frog nose, there will be, in case of any tumors or any polyp, etc., inside the nose, the whole nasal cavity will be enlarged. So when you look at the nose, it appears like a frog nose. And also and so in the vestibular area, you can see whether there is redness or this thing. Sometimes in small children, you can just tilt the head up, and you can examine the vestibular area and look for furuncle or fissure or crusting, especially in the anterior part of the nasal cavity. And also you can, whenever you are examining in inner part of the nasal cavity, then you have to look at the lateral wall, the medial wall, then the floor, roof, as well as the turbinates, etc. And sometimes you have to look for the dislocation of the septum, or you can see the septal spur, etc. So in that way, you have to examine the areas. So especially caudal dislocation can be identified in the vestibular area. So these are the septal dislocation, as you can see in the top figure. So this is the caudal dislocation. So this septum is dislocated from its vomerine groove, and I mean from the maxillary crust, and it is protruding in the left nostril. So in there you can come to know that it is caudal dislocation, and you can see the crookedness of the nose. So furunculosis, then rhinophyma, and any carcinoma of the nasal vestibule can also be identified. So you also come across ulcerated squamous cell carcinoma, or you are seeing nasal polyp. You see as pearly gray shells. You can see link which is pearly gray in color, and it is seen from protruding from the nostrils. So sometimes you have to identify whether it is a polyp or it is a turbinate. So in such cases, you have to go for the other test, that is the probe test. So in probe test, if it is a polypoidal mass, then it will be easily mobile or freely mobile, and it is insensitive to pain. But if it, and the color also is pearly white, as you can see. But if it is a turbinate, it will be laterally placed, and it will be, when especially in middle turbinate, you always get confused whether it's a turbinate, because sometimes secretions also will be enveloped about the turbinate, and it appears like a pip itself. So probing test is very important. Here you have to take up, and you have to see whether there is sensitive pain, and then you have to see the color of the turbinate, which will be reddish in color, and it appears sometimes, if it is very tender, it will be mulberry like appearance. And and it will be, you can feel the stiff bone underneath. So that is how you can identify whether it is a polyp or a turbinate. And also if there is septal abscess, you can see swelling in the medial area, and there will be redness, etc. And carcinoma also can be usually identified by seeing the irregular fragile growth, which is often whenever you try to touch it, it bleeds. So in anterior rhinoscopy, you are going to introduce the tudiculus nasal speculum. So the whenever you are introducing this speculum, always introduce it with the blades closed, and then you have to slowly introduce inside, and then slowly you have to look into the various structures, like the floor, the lateral wall, the medial wall, and the this thing roof of the nasal cavity, so that each area will be easily visible, and you will not miss any diagnosis. And also for this, you need to good torchlight, or if you are using a head mirror, that is also very fine. Or you can also use bullseye lamp, or you can use just a simple torch in order to examine. So it is a very simple examination which everyone should do in OPD, because most of the things will be identified in this. Like you can also see the in lateral wall, you can see the turbinates, and also you can identify, you can look into the osteomeatal complex, and whether there is pus in middle meatus, signifies the infection of the anterior group of sinuses. So sometimes you have to identify whether it is coming from the maxillary sinus, or it is coming from the frontal sinus. So because usually when this pus is coming from the frontal sinus, due to gravity, the pus will not be retained and it is freely flowing. So once you wipe out the pus, again after some time there will be collection of pus. If the pus was coming from the maxillary sinus, then you after wiping out the pus, you have to wait for some time. Then also if the pus doesn't come out, then you have to tilt the head to the opposite side, then the pus will flow out. So that because the ostium, the maxillary sinus is little higher up, so by tilting head to the opposite side, then the pus will be liberated. So you will come to know whether it is coming from the maxillary sinus or it is coming from the frontal sinus. So this test is called as postural test because it is based on the posture of the patient. So in that way, you can come to know about the sinusitis, or you can also by this examination, as I told you, you can identify the polyps or any growths or any deformity or septal spur. So this spur is nothing but a cartilaginous outgrowth, or there will be overriding of bone and cartilage, and it can easily be visible as a thorn. It appears like a thorn, and this septal spur also give rise symptoms like headache, and there will be epistaxis, etc. So that also should be identified by taking history, and also you can assert by the probe test. Along with this anterior anoscopy, you can also go for probing in order to look at any mass or lesion, or in order to identify whether it is a polyp or a turbinate. So next, coming to posterior anoscopy. So the posterior anoscopy, you need tongue depressor and also the posterior rhinoscopic mirror. So this here we have to ask the patient to be feel relaxed and breathe slowly from the mouth. And you have to, in order to, because you have to see the mirror image of the structures which are present in the posterior part of the nasal cavity. So that is why you have to go for fogging. So this breath will fog the mirror. So that's why you have to dip the mirror either in hot water, or you can dip it, keep it over the flame, and then check a temperature over your skin, because it must not be very hot. And then you have to depress the tongue, and you have to slowly introduce the mirror and just behind the soft palate, and you have to, without touching it, because once you touch the soft palate, it will give rise to gag reflex. So you have to see the structures which are visible in the posterior part. So you have to hold the mirror in this way, so that you can get a, as you can see in upper figure, you can, in the mirror you are going to see the different structures. So these are the structures which you are going to see. In the upper part, you can see the adenoids. So if adenoids is nothing but the nasopharyngeal tonsil, when it gets hypertrophic, it is giving the name adenoids. And we have this posterior cone, and in posterior cone, whether there is any, if the adenoids is enlarged, then it will block the posterior cone, either unilateral or bilateral. Or you can also see the posterior ends of all the three turbinates. In anterior anoscopy, you can see only the middle, anterior and middle turbinate, but in posterior anoscopy, all the three turbinates, posterior three turbinates can be visible, and posterior ends of three turbinates will be easily visible. And also you can see the Rosenmuller fossa, then the opening of the eustachian tube, and you can also see if there is any postnasal drip. So in this way, you can see there whether there is posterior cone polyp, especially the maxillary, the polyp which is coming from the maxillary sinus. Usually it will protrude backwards, and it will come behind the soft palate. So that's why you can antroconal polyp, as the term indicates, it will be seen in posterior rhinoscopy. So this will be protruding outside through the cone, and either the right or the left cone. Usually it is unilateral, and you can identify in this region. And you can also see if there is any turbinate hypertrophy, especially of the posterior ends of the turbinates, or if there is any discharge, especially in the middle meatus, which will signify the infection of the anterior group of sinuses. That also can be in posterior postnasal drip, especially from coming from the superior turbinate, also can be identified, that is from the sphenoidal sinuses. And also sometimes there will be discharge over the middle turbinate and any infective material coming out. So you can come to know so whether they are lateral pharyngeal bands hypertrophy. So because that indicates chronic postnasal drip, especially with the discharge which is coming from the frontal sinus, as well as from the from the maxillary sinus, it will come laterally, or sometimes it can be seen as pharyngeal bands in the posterior pharyngeal wall. So lateral bands or posterior bands can also be seen because of chronic postnasal drip. And also in allergic pharyngitis also you can see, examine the mucosa in this area. So this is a very important examination, and in order to visualize better, and you can use even more sophisticated instruments. So we have this nasal endoscopy. So with the nasal endoscopy, you can use this endoscopes 30 degrees, 70 degree, or 0 degree, and you can visualize the different structures in the nasal cavity, and you can also visualize the larynx and all the other structures by introducing the endoscope. So in this endoscope also we have fiber optic endoscope, which is very flexible, and or it may be in the form of rigid endoscopes. So rigid endoscopy can also be done. Here the endoscope will be very rigid, but in fiber optic endoscope, there will be flexible tube is introduced, so it will be easy in order to introduce and visualize the different structures, especially of the larynx, the oropharyngeal mucosa, and also the nasopharynx. All these structures can also be easily seen. And also we can also perform, in case of this FES, we can also treat the disease also by using this FES. In case you can treat chronic sinusitis, etc., and also any growths in this area. So next, coming to the functional examination of the nose, you have to see whether there is nasal passages are patent. So in order to see the patency, you have to use the spatula test. So you have to see the area of fogging. So whenever the patient breathes normally, then the the breath will come out, the expiratory breath will come out, and it will fog the surrounding area. If there is nasal obstruction, either unilateral or bilateral, then that fogging, then mist formation will be reduced, or it will be totally absent. So in that way, this fogging test will signify whether there is any obstruction. And also you can go for this Cottle's test. If there is obstruction at the level of the nasal vestibule, then you can go for Cottle's test. So by doing Cottle's test, then you have to elevate the cheek to laterally, and then you can the patient's nasal obstruction will be relieved. So that also can be identified. That indicates that there will be nasal obstruction in the anterior part of the nose. And also this cotton wool test can also be done. So this cotton fluff of cotton is placed below the nose, and the patient is asked to blow or inhale or exhale. Then you can see the movement of the cotton. So when he exhales, the cotton will move to the sides. So that also indicates that the nasal passages are patent. And also you have to identify the sense of smell, which is very important. So in order to identify the different types of smell, we can use 7 types of scents. But whenever you are using this, you have to close the eyes of the patient. You have to just cover the eyes of the patient so that he will not be able to see what type of scent is used. Like you can use the clove oil, peppermint, coffee essence, different types, or chili. This thing also can be used. So that will give rise to more of sniffles. And this ammonia also stimulates the central nervous system. So that also gives rise to sniffles and sneezing, etc. So that is usually not used. So next, so in that way, whenever you are identifying the various structures in the nose, you have to see what are the it is the nose is very important, because it is the dangerous area of the face, and also it is the dangerous area of the nose also, because the olfactory area, it is directly linked to the meninges. So any infection in this area can ascend to the meninges also through the olfactory route, and it give rise to meningitis, etc. And also we should never forget that nose is the common port of entry for any allergen or any dust particle, etc. So that is why we are more prone to this allergic diseases because of the pollution in the atmosphere. And nowadays in corona times also, this nose is the port of entry. So that is why we should cover our nose, so that the any this virus etc. will not be coronavirus especially will not be able to enter into the nose. So we have this rhinovirus, adenovirus, different types of viruses, or any bacteria also can easily enter into the nose, because it is mixed in the external air. So that is why we should be very careful, and we have to preserve this area, and we should look after this area, so that that is the port of entry and cause infection or other diseases. And also, according to Ayurveda, we should never forget that Nasa hi Shirosadwaram, because from the Nasa, the diseases will emerge, and it will, I mean, not only the diseases, but also it is the very important for the treatment point of view, because medicines which are administered in the nose will ascend not only into the sinuses, or also to the brain and systemic circulation, etc. Because this is a very important route of administration of medicines. And it is clearly justifies not only the sense this thing nose, but also it enters to the other sinuses, because it is having, it is a siramarma which is connected